Good afternoon, and welcome to Ask the Doc. This is the live program where we give our audience the opportunity to ask questions of our experts in dementia and Alzheimer's disease. My name is Dr. Megan Whitbrocht. I'm the Associate Director of Education here at UCI Mind. And just as a reminder, UCI Mind is one of about 35 federally designated Alzheimer's disease research centers funded by the National Institute on Aging, which is part of the National Institutes of Health. Thank you for coming today. My guest this afternoon is Dr. Christian Salazar. He's a colleague of mine. Dr. Salazar is an epidemiologist and project scientist in Dr. Joshua Grill's lab. He received his master's in public health and his PhD in epidemiology from Columbia University. Dr. Salazar at UCI Mind studies health disparities across the lifespan in vulnerable populations, particularly racial and ethno-minoritized populations. So welcome, Dr. Salazar.
Having me.
Yes, and to our viewers at home, we love questions. Ask any question that you want. Remember that whatever you post lives on the internet forever, so be conscientious of that. So with that, let's get started. Dr. Salazar, you're an epidemiologist by training. What is an epidemiologist study?
Well, that's a very good question. So an epidemiologist studies the distribution of diseases and determinants or causes of diseases in populations. And the reasons why we do that is so that we can control health problems. So by its very nature, epidemiology is a quantitative discipline, and it's considered to be the basic science of public health. So what we do is we use statistics to measure what the distribution of these factors are in populations. We collect all of that data, we represent it visually, and we hopefully use it to solve health-related problems.
Excellent. Good. So now talking about Alzheimer's disease. Is the risk of developing Alzheimer's disease similar across all races and ethnicities?
Yeah, well, first, let's define what we mean by race and ethnicity. Mm-hmm. When we talk about race, what we mean race is a societally imposed identity that is usually linked with physical characteristics like skin color or hair texture. And ethnicity, when we talk about ethnicity, what we mean is cultural factors, so a cultural expression. What are the values? What are the beliefs, the practices in a population? So it's fundamentally a learned behavior. But it's important to note that, when we talk about race and ethnicity, these are social constructs that are used to categorize people and to characterize people who are seemingly from distinct populations, but it has no biological significance, or it's not meaningful biologically. So, for example, if we wanted to look at what are the genetic risk factors for Alzheimer's disease, using the construct of race and ethnicity, if we look at Latinos or Hispanics, we have a genetic ancestry that is mixed. So we have a lot of European ancestry there. We have a lot of Native American ancestry and African ancestry in various different proportions depending on where in the world we live in. So it represents many different, we Latinos represent so many different countries of origin. Each country could have distinct cultures, and the way we speak Spanish might be different. So there are nuances in the Spanish language. And so for those reasons, if we wanted to understand what are the fundamental root causes of Alzheimer's disease, race and ethnicity may not be the best choice of a factor to look at. But that said, race and ethnicity is useful for describing health disparities. And it allows public health experts to allocate resources where they are needed. And when it comes to Alzheimer's disease, the weight of the evidence suggests that Black and Latino Americans have a higher prevalence and a higher risk of developing Alzheimer's disease and dementia than their white counterparts.
Very good. And why is that? Why are there differences, or why are African Americans and Latinos at higher risk for developing Alzheimer's disease?
Well, these differences could be at least partially explained by some discrepancies in the specificity of some of our neuropsychological instruments that are used to detect, cognitive impairment across cultures. That has been one of partially why we are seeing these differences, but also there could be an unequal distribution of the risk factors for dementia across populations. So about a couple of years ago, the Lancet Commission published a paper that looked at what are the they did a review of the literature, and they wanted to look at what were the risk factors, the major risk factors for dementia. And what they found was they identified 12 risk factors that explained the prevalence of dementia in the literature. So these studies came from all over the world, and they were able to explain 40%, with these 12 factors, they were able to explain 40% of all dementia cases from those studies. So what that tells us is that two things. One is that some of these factors, we can intervene on them. We could potentially intervene on them so that we can address these factors. And then secondly, what we learned is that, well, we don't know what the other 60%, we couldn't explain the other 60% of dementia cases. So what that means is that we don't know what these factors are. So we have a lot to do, a lot more work to do to understand what these factors are. So getting back to race and ethnicity, well, it could be that the distribution of these risk factors that we do know about, and also the risk factors that we don't know about, may be more prevalent, or it could occur more frequently in minoritized populations, and that could maybe help to explain some of these disparities that we see in the community.
Mm-hmm. And can you tell us what some of those risk factors are that we know about, that 40%?
Sure. Yeah, sure. So some of the things that were found had to do with low education, physical inactivity. They looked at these risk factors across the lifespan. So early life education was explained about 8% of dementia cases in that study. And just to give you an example of some of the things that we can do, we often talk about should we have early childhood education in this country? And many argue, well, it benefits us because it helps us to raise the socioeconomic status of minoritized populations. But here we can see that it might also improve cognition maybe in the future, and it could improve, it could lower the risk, it might lower the risk of dementia later in life. So that's just one example of a risk factor. There are others, but one thing that we should note, however, is that there has been a lack of research into other areas like the social determinants of health. So what are the social causes of disease? What are the social causes of Alzheimer's disease and related dementias? And here, I think there is an incredible opportunity to do more work. We have to look at the built environment, some of the key features of neighborhoods that make a neighborhood disadvantaged, so that perhaps minoritized populations don't have access to healthcare, and therefore are not able to access medicines and healthcare in these neighborhoods. So we need to look at that. We need to look at perceived discrimination as a potential cause of dementia. We need to look at some of the other features of stress, living in a disadvantaged neighborhood, whether that could play a role on stress, and whether that has an effect down the line with cognition. And other things have to do with other risk factors that have been looked at are hypertension in midlife, whether you have access to medicines that can control hypertension. So these are things that I think we could learn more about if we did more work focusing on what are the social causes of disease. And that's an area where I think there's low-hanging fruit. We have not explored as much as we should in these areas. And I hope to look at that in my future work.
Good. That kind of leads us into our next set of questions. So we've talked about a differential risk between race and ethnicity, but can we talk about research participation? Are there differences in research participation by race and ethnicity?
Yes, indeed there are, and minoritized populations are severely underrepresented in Alzheimer's research. Just to give you an example, less than 10% of Latinos participate in Alzheimer's disease research, and less than 1%, according to one review paper, less than 1% of Latinos participate in Alzheimer's disease clinical trials. So these statistics are staggering, because without their participation, we won't know whether these medicines and these interventions, we won't know whether they will work in the community. And so it's incredibly important for Latinos and Hispanics to participate. Similarly, for African Americans, we see the similar patterns. And for Asian and Pacific Islanders, we don't have a lot of data to go by, and that's troublesome, because without having these statistics, as I mentioned earlier, in epidemiology, we need these statistics so that we can do something in the community. Without having these statistics, there's not much that we can do.
So what are some of the reasons why we see these disparities in research participation?
Yeah, and it's an active area of investigation, and it's something, these barriers are something that we are trying to get a handle over. There's been some work to look at whether trust in medical care is an issue. So whether certain minoritized populations have trust in their doctors and trust in medicine in general, the healthcare system. We've seen a lot of issues just from the pandemic when it came to COVID vaccines, for instance, where there's a lot of hesitancy in getting vaccinated, which we know is a huge public health triumph. We've done so much to move ahead with vaccines that for us to not believe in them is pretty troublesome. So we need to look at trust as one potential barrier. We need to look at awareness of Alzheimer's disease in our communities. We need to also focus on awareness of studies that look at Alzheimer's disease and potential treatments. Without knowledge of what these studies are, the community cannot benefit from them. So if they don't know that these studies are ongoing, then they're less likely to participate. And then when it comes to trust, going back to trust, there has been, unfortunately, a historical challenge when it comes to African Americans and participating in studies because of the Tuskegee study, which was a study that was done in the 1940s, where they had a treatment that wasn't used in the African American community, and they knew about the treatment, but African Americans were part of the study. They didn't use the treatment. They wanted to investigators wanted to just let it go and see whether the disease manifested in this population. And that was unfortunate because it led to a lack of trust in the African American community. So that legacy of Tuskegee lives on till now, and there's a lack of trust in all facets of all areas of research, I think. But there needs to be more studies to look at this issue of trust. Another area that I think is important to look at is sociocultural factors that might help to explain some of these differential patterns of research participation. So for instance, in my work, I'm looking specifically at Latinos, and I'm looking at issues of fatalism, issues of familism, and how decisions are made in the family unit to decide whether or not to participate in studies. And so it's an interesting area of research at this time.
Dr. Salazar, you brought up two terms that I'd like you to define for the audience. You said ableism and familism? What?
Fatalism and familism, yeah. So fatalism is this idea that that you don't have control over your healthcare, and it's very prominent in the Latino community. This idea that, well, I don't have control over my health. It's up to some other higher power, God, or whatever it is, and for that reason, I shouldn't care really about getting vaccinated or getting involved in anything having to do with healthcare, because it's not up to me to. It's not up to the doctor. It's just up to some higher power, and so it provides a barrier for us to really intervene, and so these kinds of issues, I think, are going to have an effect on research participation. So that's one area, and then familism. This notion that decisions are made in a family unit, and oftentimes we talk about how the individual has his or her own responsibility for making a decision around participating in a study or participating in a trial, and oftentimes within the Latino community, it's the family that really is involved in that decision-making process. So familism, I think, is going to be important, an important consideration. There's also stigma in the Asian American population, stigma about, well, I don't want to disclose my, I don't want to get tested because I might be labeled or as crazy or some other label. And so that stigma, they don't want that stigma to be present by getting a diagnosis. So that presents a challenge for us. How do we get around stigma? How do we get around these issues? And so these are the kinds of things that I think will need to happen, and we need to study this a little more closely. Mm-hmm. One last thing I wanted to also mention is that we as investigators also, I believe, have a responsibility to develop a relationship with the community. And that means that, it's not enough to go into a community and set up a trial and then just leave right afterwards. You need to have a relationship with the community. You need to be able to work with community members, with community leaders, and be able to do the needed work to get buy-in from the community, to develop that trust that I was talking about, and to be able to extend it beyond the study, to have resources available for people who might be in our studies and might need to come off because the study has ended. So these are the kinds of issues that I think we need to tackle. We need best strategies of what works, what doesn't work when it comes to research. This area of research, of recruitment and retention is a new discipline, a growing discipline, an emerging discipline that is becoming more prominent in our research. And I think we need a lot more work to know what are the factors that what are the drivers of recruitment, what are the drivers of retention in our minoritized populations.
So I know you mentioned this previously, but I think it's important to reiterate. Why does it matter if Latinos, African Americans, and Asians participate in research?
Yes, so without their participation, we're not able to know whether the interventions or the treatments that we are testing, whether these will benefit these groups. And so this has to do with this notion of validity. How valid are your studies? And so in epidemiology, we sometimes talk about having good internal validity. So what that means is that if you're testing a treatment and you have a control group, how valid is it that your treatment showed a benefit in your study population? But another kind of validity is external validity. Okay, so if we find that a treatment worked and a treatment we find validity in it, whether those findings now could be replicated in another population that was not studied in that research study. So, you don't know that, and you're not able to make that suggestion that yes, these findings might be applicable to this other population because they weren't in your study. So it lacks external validity, and I think that's the key thing about why it matters that minoritized populations participate in these trials, because we want these treatments to work in these populations.
Mm-hmm. We have a question from the audience. You may or may not know this. We're not experts in COVID-19, but you are an epidemiologist, so perhaps you can comment. The question is, should we add COVID-19 as a new risk factor for dementia?
Yes, and I'm not the expert on that. I don't know the latest research on COVID-19 and its effects on the brain. So I unfortunately don't have an answer for you. I'm sorry.
Great. Well, maybe we can have a guest on in a few months that could help us answer that. But you do know a lot about a lot of different subjects. So we'll get back to our list of questions. Why did you get involved in Alzheimer's disease research, Dr. Salazar?
It's a great question. And part of the reason why I got involved is because, well, like many Latinos, I have a family history of Alzheimer's disease. My grandmother passed away about a decade ago because of Alzheimer's disease. And what's interesting is that, when I speak to my dad about it, because he knew what was going on a little bit more than I did. But having a grandmother who was diagnosed with Alzheimer's in my home country of Ecuador was a very difficult process and a very difficult situation. There were a lot of things that were not known, I guess, at the time about how to help her and how to react to a diagnosis such as this. So there was a lot of, as many Latinos know, the family unit is affected, and usually it's the adult children who take care of the parent when a diagnosis like this happens. And so with my grandmother, it was very difficult for her to get a diagnosis and for my aunts to be the caregivers her, and it was very, very difficult experience for all of us. And so that made me interested in learning more about, well, how do we prevent this? How do we prevent future generations from having, how do I prevent my kids from having Alzheimer's? So I worry about that, and I wanted to sort of contribute to the research that's ongoing now, and I feel like I could contribute to this research because we're sort of at the cutting edge of discovery here, and I'm very lucky to be a part of the research community when it comes to Alzheimer's disease.
Great. We have time for a few more questions. Can you talk briefly about the research that you're doing here?
Right. So I briefly touched upon it. I do research in the Latino and Hispanic community. And one of the things I like to learn about is what are the factors that drive participation in trials, particularly preclinical trials or prevention trials of Alzheimer's disease. And prevention trials for Alzheimer's disease is unique because we are asking participants who don't have a diagnosis of Alzheimer's. So they don't know that they may be at risk of Alzheimer's. And we're asking them to participate in a study. And we're asking them to get a biomarker test done for Alzheimer's. And the issues around biomarker testing, I think, are very important because we don't know how Latinos will react when they get a report of, yes, well, I have a positive biomarker test for Alzheimer's disease. So these kinds of questions, I think, are questions that I would like to learn from the Latino community. And also the other key feature of prevention trials is that one needs to have a study partner to enroll in these trials. What that means, a study partner is just a person who can come to some of the visits and support the person during the course of the trial. And it's important to have a study partner available. But sometimes if the study partner is an adult child, there are some issues with the child not having enough time to participate, or may not be a reliable source of information because they might be not with the parent at all times. So these issues are issues that I'm researching and I'm learning more about, and hopefully, we can understand barriers to participating in these kinds of studies, these kinds of trials, and we can learn also about how Latinos make a decision to participate in these kinds of studies. So that's in general what I'm looking at.
Excellent. And where should people go if they want to learn more about your research?
Sure. So they can go to my Twitter handle at Chris Salazar, PhD.
Very good. Okay, one last question. What does UCI Mind do in diverse communities?
Yes, so we do a lot. We do a lot, and we just to give you an example, I recently was funded through a KO1 award, NIA, to look at some of this research in the Latino community. I also have a fellowship from the Alzheimer's Association to look at participating in Alzheimer's disease registries. And I work, and then we also have funding through the ADRC and the ORE core that emphasizes bridging the gaps with the community. I also have a colleague, Dr. Haiwan Shin, who does a lot of work in the Asian American and Pacific Islander community here in Orange County. And she works closely with our ADRC and with collaborators of the CARE network And there's also an anticipated study looking at the genetics of Asian Americans and Pacific Islanders and how that impacts Alzheimer's disease. And this is in partnership with other sites around the country. We also have support from the Crean Foundation to bring more people into research through the Consent to Contact Registry, which is now available in about 5 different languages. And we also have efforts to diversify researchers through our innovative program, the Beale Scholars Program, which, by the way, was one of my favorite programs. And it has included so far about over 30 highly diverse local high schools. And what we do is we bring high school students here to UCI Mind, and we show them STEM-related careers, and we introduce them to neuroscience, we introduce them to epidemiology, we introduce them to these different disciplines so that they can learn more about what we do and why it's important to work with communities. So I'm very excited about all this work that we're doing in the community here at UCI Mind.
I am excited too. Dr. Salazar, I feel like we barely scratched the surface. I would love to have you back on if you'd be willing to join us maybe in a few months or something like that.
Yeah, I'd be happy to.
Great. Well, thank you. And to our audience, thank you for joining us today. Next month, we plan to have Dr. Leslie Thompson come on and talk about Huntington's disease. So after this program ends, we will upload it to our Mindcast media platform. There you'll find several different programs. One that we're very proud of is our podcast, Spotlight on Care, that was recently rated 9th best Alzheimer's disease podcast. So go there and check it out. If you're interested in participating in research, please visit our website or go to our Consent to Contact Registry that Dr. Salazar mentioned. This gives people an opportunity to get matched with studies that are currently recruiting people. So thank you everyone for joining us. We'll see you next month on Ask the Doc. Take care.